let's talk about those symptoms that we're screaming at our doctors with.
Yeah. Yeah. Well, I mean, I would say the top 3 are the weight gain or inability to lose weight, fatigue, and hair loss. Those are just the top 3. Now, because the thyroid is the master gland, like you said earlier, it runs the show of your entire body. So you could have high blood pressure, low blood pressure, dysregulated insulin. You could be type 2 diabetic and be eating keto carnivore. And it's all because the thyroid has control over regulating your glucose level. So when glucose is all erratic, and you're like, wait, I'm not eating carbohydrates, it could go back to the thyroid. We said earlier, constipation, muscle and joint pain, inflammation, just even full body water retention. The thyroid is notorious for causing water retention. And we'll actually see something called myxedema, which is moon phase. So we'll see this extra thickening of the arms usually. And it's almost like you can tell this isn't fat. It's like a thickened layer, like there's a boatload of water underneath the surface. And
Mhm.
then the face, which I absolutely had, the face just goes into this big poofy moon face. The neck will get swollen glands, hoarseness, voice changes. I mean, it really goes on and on and on, the different symptoms that can occur. But the top 3 would be the weight, energy, and hair.
So we talked a little bit about what has been going on with me over the last couple months. I was exposed to some viral activity. My liver enzymes were through the roof. Everyone knows I love my liver and I take care of my liver. So why me? Honestly, it's a God thing because if I can fix me, then I'm
That's
going to be
it.
able to fix all of you guys. So
Yep.
this is the great news and the takeaways. My reverse T3 was through the roof. My cholesterol was high, but my cholesterol is always high, but the good is high and the bad is low because I work out and I always have. So that's good. With me, the first signs of hypo, because I can go hyper and hypo. I can feel the difference in me. My rings, I can't pull them off. I can't see my ankle bones. I'm bloated. I'm constipated.
Mhm.
And
Yep.
there's that thickness. I literally see the thickness around my elbows, and that's not a
Okay.
place you put fat. So
Now,
so you can't mistaken it for fat, and that's why I'm pointing these different body parts out. You don't get fat in your fingers, really. You don't get fat in your ankles, but it's that edema and the swelling.
mhm.
And when my thyroid's working, I don't have it at all. Cold intolerance when everyone else is warm. Heart
Yep.
rate. So this was interesting, is that when I'm hyper, my sleep score, my aura, my heart rate is not coming down. On a good day, when my heart rate is normal, my heart rate gets down to like 42. It's always been low.
Mhm.
When it's not, and my aura ring says you did not rest last night, it's like at a 49 or a 50, which might be good for somebody else, but that is showing me that I'm a little hyper. So
Okay.
that is something to think about. Insulin resistance. So we talked about before we came on what came first,
Mhm.
insulin resistance or liver issues or thyroid issues. My blood sugar, my fasting blood sugar was 100, which is way too high.
So wild for you. Yeah. Yeah.
My fasting insulin was a 3, which will tell you that I don't have prediabetes or I have
Right.
a really good insulin response.
Yep.
So that's what's so crazy. So these crazy numbers is showing that there's something else going on, that it's not just thyroid, but it went back to my liver. My liver was not functioning right. And so that is going to affect the thyroid numbers. And can you tell us why?
Absolutely. So yeah, we have to love on our liver, and it is crazy. I agree with you that this is a God thing, and it's helpful for me too because whenever we have someone like you they're doing all the things. I know how you eat. I know how you take care of yourself. I know that you're on top of your sleep, you're on top of your supplements. You are taking care of your liver. So when I have a friend that presents with some really wacky numbers on their labs, it's like, all right, let's dive in and figure this out. This is going to be fun. So you and I went back and forth numerous times about like, what could this be? What could this be? Like, what is driving up your reverse T3? And And it's interesting as we go through your liver and the different things that your liver had to deal with, that it was exposed to in a short amount of time, that in and of itself, one of those things in a singular exposure away from the other factors, you probably would have been okay.
Right.
It was the stacking of multiple things that even the best taken care of livers can eventually say, you know what, piss off. I'm just not going to do my job right now because I just feel burdened. I feel overloaded and burdened. So, yes, that could be it probably is the sole reason why your reverse T3 went up. And it was total survival mode by your body.
Right.
Thank God our bodies know that when we're struggling, push up that reverse T3. You didn't need to burn fat. You didn't need to have energy. You didn't need to think clearly for a while. And you might disagree, but your body says, listen, we want to protect the liver because the liver does so much. The liver keeps you alive. The liver protects you from toxins. The liver protects you from everything. It's filtering out the bad. Not only that, it's helping to convert T4 to T3.
Right.
It's helping with our hormone balance. Everything gets processed through the liver. Over 500 metabolic processes happen with the liver. So your body knows, listen, Sarah, you don't really need to have energy. You need your liver working. And that's our first and foremost job today. So it pushed up your reverse T3. Totally makes sense. And this really sheds light on the importance of looking at liver and liver function and not just going by numbers. I mean, we did have some numbers on labs for you that we could look at that kind of, alerted us, hey, we need to pay attention to this. But oftentimes, you may or may not get that true elevation, and you probably won't even get flagged high in those liver markers like ALT, AST, alkaline phosphatase. I've seen people with fatty livers that those numbers are within normal limits. But again, when you're working with a functionally based provider, practitioner, they're going to look at those liver numbers a little bit differently. And we have our optimal ranges where we like to see things so that if someone is starting to climb a little bit early in the game, no, their PCP hasn't said anything to them about their liver, but we look at it, we go, you would really benefit from some help here. Maybe a detox, nice little liver cleanse, then let's do some support, because if this isn't working, then we can throw all the thyroid medication at you, we can
Yeah.
throw hormones at you, we can pile on a bunch of other supplements, and it's not going to work. It has to start with your liver. It has to.
So something to add into that is, and yes, this is part of my God story. My daughter was having horrific PMS symptoms. I had talked to you about that. Come to find out, she was exposed to the spike protein, which really messed her up. One doctor wanted to put her on progesterone, and I said, okay, I am really hesitant about hormones, especially with a 17-year-old, but she was so miserable. I'm like, I need to help my child.
Yeah.
But then I talked to another practitioner. She said, no, she's so fat malabsorbed. What does that mean? And so am I. Your
Mhm.
liver's where you process and metabolize fat. If your liver's overburdened, hell no, it's not going to. Stop the ketogenic diet. Most people today cannot handle a high fat diet. I'm not saying that it didn't work in the past, but we have the spike protein, the microplastics, the GMOs, the glyphosate, all these things that are stacking up on our livers on top of the other stuff that my liver was dealing with, and then on top of what she was dealing with, that her body could not process fat. Now, how did I know as a mom? Do I listen to the doctor who says progesterone, or do I listen to the practitioner that says, absolutely not? We are going to use antivirals to get rid of certain things,
Mhm.
to let the liver rest,
Yep.
put her on a zero fat diet, which I currently am on. And it is not easy, but hey, if you tell me to eat cardboard and I'll feel good, I will eat cardboard
Right,
because,
right.
because I want to feel good. So she originally, I'm like, how do I know? Well, before we started the progesterone that we never ended up starting, we put her on pregnenolone for
Mhm.
3 days. And I saw this little petite girl go from little petite girl to shrinking and shrinking and shrinking because she had zero appetite just over 3 days. And I'm like, oh my gosh, we're going backwards. Well, pregnenolone's a hormone. These hormones are fat based. They need to be, your liver needs to be able to process them for them to work. So your liver can't even do anything with it if it can't process a fat based hormone. So we
Right.
stopped the pregnenolone. We put her on a vegan diet for 3 days and then added in some lean wild animal protein, did the antivirals, did some other things, and she's back. And we have gotten her, we've gotten back to baseline, and now we're on the push to where her appetite is roaring and she's thriving. We never had to do the progesterone because that was going to help with the symptoms. That was not going to help with the root cause. What was causing low progesterone? What was causing the hormonal imbalances and the PMS to be so bad? And that was the other things, and liver was part of it because things were just stacking up. So the same with me. So with me, not I thought I felt good, and I told you that. I said, Amie, this is so weird. I wouldn't know that my liver enzymes were high except for I got them tested, and I wouldn't know that my reverse T3 is high because I feel good. Well, you only think you feel as good as you know what good feels like, right?
Right. Right.
So fast forward to today, when I have loved on my liver, I've backed off on the fat, I have corrected some of the things that were causing, it was viral related, that was causing my liver enzymes to go up. So as I've connected those dots, my vision is clear. I'm 48 years old. I don't need glasses. All three of my siblings are on glasses. My mom even commented that she had to start wearing glasses at 40.
Okay.
And I thought my vision was going blurry and then coming back and blurry and coming back. And now thinking back to it, it was related to stress on my liver. Like when my liver was stressed, my vision would go blurry. So my vision has improved significantly more consistently. My energy is up. I feel my thyroid up, even though I haven't tested it. And you know what? It might be placebo. I don't know. I'll take it, whatever.
Yeah. Who
Um,
cares?
right. So I really wanted to emphasize the fact that, you know, thyroid issues might be connected to something deeper. And then that something deeper, like your liver issues, might be caused by thyroid issues. And heart disease might be caused by thyroid issues. Something that most people don't know is a sign of hypothyroidism is high cholesterol and
Mhm.
heart issues. So beyond just the obvious of weight gain and hair loss, there's some more serious side effects of low thyroid. So are there any others that I'm missing?
Yeah, a couple just popped into my head too, worth mentioning, fertility. So, if you've had multiple miscarriages, if you had trouble getting pregnant, if you're having trouble getting pregnant, go back and look at the thyroid. Start there, and please do not, "Oh, well, my OBGYN said my thyroid was normal." It goes back to what we said in the beginning. Did they even test everything? If they're just testing your TSH and your free T4, that's not going to tell us anything. There are important markers that we have to look at: free T3, reverse T3, and then TPO and TGA antibodies for Hashimoto's. We want to look at that, and we want to make sure that your thyroid is optimized, because if the thyroid is not optimized, number one, you're going to have a hard time getting pregnant. Number two, if you do get pregnant, we have to think about the baby and the baby's brain development.
Mm.
Now, I speak about this a ton on my podcast because it's near and dear to my heart. My stepson is 12 years old, nonverbal, autistic, severely developmentally delayed. So he's 12, but he's really more like 3. Will never be on his own. We know that. Like, he will need help the rest of his life. And, it's so hard on my husband. And I can't even imagine how hard it is on his mom, because she doesn't have a normal mom life. Like, she's not going to soccer games and parties or anything like that. When I look at her, I see hypothyroidism. She had 2 miscarriages. The doctors told her everything is fine. Just go ahead and try again. And it's like, if maybe women take a little bit more time, and this is what I tell my audience as well. You can take another 6 months to prime your body and make sure, work with somebody who knows what they're doing with the thyroid. Make sure that your thyroid is optimized before you conceive, because that 6-month waiting time of doing some work, investing in yourself, getting your thyroid optimized could mean 40 years
Yeah.
of you taking care of another human being. Could you wait 6 months?
Yeah.
So that is my message to women too, in regards to the thyroid and pregnancy.
Well, as you're talking, I'm just thinking about me. I had PCOS. Now, I had always had high blood sugar. This is another thing that I found out about myself. I did a DNA test that said, Sara, you do better on a high protein, high carb diet, low fat. And
Mhm.
I've always intuitively not wanted to eat fat. It never felt good to me.
Mhm.
Well, high fat diet can make me insulin resistant. And here people are stopping the carbs,
Right?
thinking that that is the cause of insulin resistance. And insulin resistance can come from your fat cells being overstuffed with all these toxins we're
Yep.
talking about, or just too much fat.
Right.
And that can cause the insulin resistance, which can be connected to PCOS, which can be connected to infertility. So
Mhm.
as I'm thinking back to my past, but what did the doctor give me? Clomid.
Yep.
I
Yep.
am super blessed that all three of my kids are healthy. Like looking back on it, I'm like, oh my gosh, I should be taken away for what I did to my son. He was my firstborn. You know, I had the microwavable corn dogs. I had I was I was microwaving breast milk. So when I say that, people, I want you to know that regardless of where you're starting on your health journey, there is hope, because I started at the rock bottom. And I always tell my son, thank you for digging yourself out of my hole that I dug for you.